Now we continue with our introduction to a lot of pharmacology topics, and for this evening, the next topic we should be looking at is if someone has poisoning with cocaine, that's cocaine overdose, or poisoning with what amphetamine. So these two types of poisonings, we'll get to look at them. So this first picture here, of course, is what's cocaine, and next we have amphetamine, which is also known as paracetamol. Now, just so you know, both of them, they will give you likely the same symptoms. So that's why we're actually discussing them together. So they are potent stimulants, and they can cause serious and sometimes even fatal poisoning when you take them in excess. So what's the mechanism of action for amphetamine? It releases a lot of dopamine, norepinephrine, and serotonin. Okay, this is what inhibits their reuptake. So they'll now be in the synaptic cleft for a long time, causing you a lot of issues. How about cocaine? Cocaine blocks the reuptake of dopamine, norepinephrine, and serotonin. Do you understand? So you have a lot of dopamine, you have a lot of norepinephrine, you have a lot of serotonin in the synaptic cleft there, causing you a lot of stimulation. So symptoms, you have all those neuropsychiatric issues, you're agitated, delirium, psychosis, you're having seizures, you're having hyperthermia, okay, intracranial hemorrhage or stroke. Cardiovascular, you're having all those, hypertension and tachycardia. So also arrhythmias, coronary vasospasm, aortic dissection. So other ones can have myocardial where there is dilated pupil, muscle rigidity, muscle breakdown, that's rhabdomyolysis, which could lead to kidney injury. So you diagnose it from clinical suspicion based on history, and you're trying to ask questions around, have this patient been exposed to anything cocaine or amphetamine within that time. They do toxicology blood tests, you do ECGs and cardiac enzymes, just to pick up the issue. The management includes supportive care where you're making sure that the person is breathing. They can also give the person drugs that will cause them to sleep, Then cooling measures if the temperature is too high. Then avoid beta blockers though, so treat complications. If there's all those rhabdomyolysis, that's muscle breakdown, or if there's psychosis, you give antipsychotic drugs.